Hi, my name's Caroline Angus. I'm Director of the Integrated Care Academy.
And I'm Professor Valerie Gladwell, and I head up the research within the Integrated Care Academy and also work at the University of Suffolk.
The Integrated Care Academy was asked to support the annual public health report to understand and develop what are some solutions that we can establish to support our ageing well population going forwards, and how we can work with our people and communities to understand what it is that they want and what will help them thrive as ageing well communities. So we established a series of challenge labs across Suffolk County Council, including Bury St Edmunds, Lowestoft, Ipswich areas, and brought together a number of different key stakeholders from across the area who are working in their local communities and really understand them well.
It's a very participatory approach. They didn't sit down very long. There's lots of kind of engaging, lots of moving around to try and make sure that people can really explore what it means to them, and it involved kind of different aspects, including mapping what already existed. That was really important. What the challenges kind of were to ageing well, but also where there was actually things that were working well, rather than just saying let's redesign something. Let's see what is actually working well, and could we use that as part of the solutions going forward. So one thing that came out really strongly, that ageing is not a number. It's not a biological number. It can happen at any point, and we need to be thinking about that before we actually get old. And it's not about the frail people, and we really need to be focusing on solutions that are kind of earlier in that pathway.
I think some of it as well was recognising that actually ageing well is a really positive part of everybody's life as well. So it can be where people have more opportunity to do volunteering or part-time work. People benefit the wider economy as well, and recognising what people as they age can bring to younger people and their wider communities. I think there was a real recognition of being part of a community. So some of the cross-cutting solutions were about development of community hubs and what that would look like in different communities as well. So I think there was a real essence about it being grounded from a bottom-up approach in the community, and really co-producing with those communities what they wanted and what would be of benefit to them. And I think it's about how do we prioritise some of the programmes of work, because we can't do everything all at once. So what is going to be the most beneficial and the most impactful in the short term? What are some of the big blue sky thinking that is going to take a longer time to develop a strategy and look for the right type of investment in order to take some of the bigger challenges forwards? And I think what's really helpful is that we recognise the benefit and impact that certain community projects, for example, might have made. What are the changes that you might need to make to apply them into a different setting? What is going to be the impact? So let's think about how we recognise and monitor the impact, and then what is the next iteration of that? So how do we continue to move forwards?
Yeah, and I think obviously coming from an evaluation and an academic background, of course I'm going to get in the fact that we need to make sure that we explore it, we evaluate it, but not in the evaluate it and see what's happened and then give a report back, but actually build that in as part of it, and as about that feedback loop. When people went out the room, there was connections that they were going to act on, not necessarily just to do with healthy ageing, but that they just formed these relationships.
I think they felt that they owned the piece of work, which I think is really important, because it's not about us saying, well, what projects can we do very specifically around this? It's about giving them a sense of how it enables them to take things forwards for themselves. We definitely can't do this on our own. I think Valerie's already mentioned it's about doing with people, not doing to people. What was really strongly came through was how the community is really central to what we do, and community looks different in different places, doesn't it?
I just think that we all need to think about ageing well. We need to be thinking about it from an earlier age and not waiting by chance, because we all are living longer, but if we want to live a better life, we need to be thinking about what that looks like, not only for ourselves but those around us as well.